So here the question is about pacemaker dual chamber. So first you need to be aware about the difference between single chamber and dual chamber. Single chamber pacemaker means they will insert electrode only to one chamber. Okay, it will be like right ventricle. Coming to dual chamber, here they'll utilize two chambers. It will be like right atrium and right ventricle. Okay, so we will be considering it as dual chamber as the two chambers have been utilized. And what is non-rate responsive? Like it's a type, it's the function of that particular pacemaker. So few will be non-rate responsive pacemaker and few will be rate responsive pacemaker. So non-responsive pacemaker means like that particular pacemaker, it will not have a function or it doesn't adjust the pacing rate based on the body's activity levels or physical demand. Okay, coming to rate responsive pacemakers, the function of rate responsive is like they will be automatic. Okay, they will have the sensor, so that sensor will detect the movement or breathing or any other factor, and it does adjust for any variations. Okay, so here our question is non-rate responsive. You can see the description. C2619 is dual chamber non-rate responsive. C2620 is pacemaker single chamber. Okay, we having question regarding dual chamber and non-rate responsive. So answer is C2619. Option A is correct. Next question, non-Medicare patient with type 1 diabetes is prescribed with continuous glucose monitoring to track the blood glucose level in real time. Patient rented CGMS for 4 months. What is the correct HCPCS code? So here, as you can see, patient has opted CGMS for rent. Okay, check this code description S1031, continuous non-invasive glucose monitoring device rental, including sensor and sensor replacement. So the answer should be S1031. What is the correct HCPCS code for flexible cervical non-adjustable foam collar? So you can check these options. So this foam collar will be utilized like it's a neck brace. Okay, and it will be like a soft foam material. So L0120 cervical flexible non-adjustable prefabricated. Okay, like it is already made. So answer is L0120. And next, what is the correct HCPCS code for service performed by qualified occupational therapist in the home health setting? So service performed by occupational therapist. Answer is G0152. G0152 service performed by qualified occupational therapist in the home health or hospice setting. Okay, 152 is the correct answer. So next, patient has an insulin pump of 100 units. Administration through DME. The pump is filled. Which code reports the supply? So here you can check the code's description carefully. J1815 is injection insulin per 5 units. So here they are directly giving injection. Okay, and then next J1817 is insulin for administration through DME, that is like durable medical equipment. So this is covered under the service of DME service. Okay, insulin pump will come under DME. So according to that, for this particular question, answer is C. Okay, J1817 with units 2 because it carries 50 per unit. So we have 100 units, so we need to give 2 units. Okay, if they specify only insulin injection, then you need to consider per 5 unit, then you need to select J1815 with units 20. Okay, but for this particular question, you can go with J1817 with units 2. Next, a patient with a malignant lymphoma is administered the anti-neoplastic drug rituximab and then a Benadryl. Which HCPCS level codes reported for both the drug administered intramuscular? So here both drugs are given through intramuscular only. Okay, so you can check this code J9312 injection 10 mg, J1200 injection up to 50 mg. So check the question and check the option between option A and option D. So J9312 into 80. Okay, since J9312 carries only 10 microgram, here they have given 800 microgram. Okay, 10 into 80, we will get 800. So this option is correct. And J1200 up to 50 mg. So they have given 100 mg. 50 plus 50, J1200 with units 2. Okay, and option D is, here they have given Q0163, so which is a oral drug. Okay, but here in our question both the drug are given through intramuscular, so that means injection. So we need to select answer as A. Option A is correct. Next question, what is the HCPCS level 2 code for Medicare patient wound closure using tissue adhesive only? So tissue adhesive only being used. Normally if you code for any kind of laceration repair which is closed with only adhesive, or we don't code any integumentary codes. Okay, so then if patient is Medicare and utilized only adhesive to close the wound, then we need to code G0168. G0168 wound closure utilizing tissue adhesive only. Answer is B. So last question, Medicare recipient present for an influenza and pneumococcal vaccination. So influenza vaccine Medicare, for the particularly Medicare patient, influenza administration code is G0008, that is G0008, and for pneumococcal G0009. Okay, so answer is C. We will select answer as C. Okay, so these are the repeated questions which I have got. Okay, and definitely 2024 also many of the questions came from these questions only. So easily refer these questions after your regular practice, and I hope you can secure 3 marks. Okay, so that's all guys for today, and please subscribe to my channel and share with your medical coding friends. Thank you for watching. They have administered 200 mg of testosterone drug. So whenever you see or whenever you are coding for injection, first you should check a route of administration. Are they injecting through intramuscular or intra-arterial? So if they are administering through intramuscular, then you will select 96372 as your admin code. If they give injection through intra-arterial, then you should select 96373 as your admin code. Okay, so in our current question, they have given injection through intramuscular. So 96372 will be your administration code. So now you have to code for drug. So they have given 200 mg of testosterone. So whenever you are coding for drug, the first thing that you have to check is the base value of the current drug which is being administered. So if you check testosterone base value of the particular drug, it is only 1 mg. Okay, it carries 1 mg alone. So here they have given 200 mg. That means you should give units 200. Okay, so then we will be getting 200 mg. So the correct answer is J1071 with units 200 and 96372. So if you get this question, make sure you are selecting this as your answer. Okay. So next question. Patient comes with nausea, emesis, along with the severe stomach pain due to dehydration. So normal saline is infused, and in the same bag with a 2 mg ondansetron, then dose of 15 mg of ketorolac was given for the stomach pain. So here they have given two drugs. Okay, one is aldosterone and also 15 mg of ketorolac. So again, same thing, you have to check the base value of the drug, okay, before proceeding with the coding. So check the base value of the J2405, which is ondansetron. So it also carries only 1 mg, okay, per 1 mg. The base value is 1 mg. And same way J1885, which is an injection of ketorolac, it carries 15 mg. So it's clear, since they have given 2 mg of ondansetron, you should give J2405 with units 2, and J1885 you don't have to utilize any units because the base value itself 15 mg. So the correct answer is J2405 with units 2 and J1885. Okay, this is again important, and so please make sure you are choosing this particular option. So I hope both our questions are clear. So let's move forward to our other questions. So next question they have asked about, like you can see, standard weight frame power wheelchair. So it is a equipment. So here wheelchair, standard wheelchair they have ordered. So you can check the code description of K0010. So K0010 says standard weight frame motorized or power wheelchair. Okay, so power wheelchair, which is correct. So you should select K0010. So how they will question? No? They will question like, standard weight frame power wheelchair has been ordered. What is the level 2 HCPCS code for will be reported for this scenario? Okay, so likewise complete question will look like. So answer K0010. Next question, 2 units of fresh frozen plasma 12 hours after collection. So here frozen plasma, okay, and also here they are talking about the duration, that is 12 hours after collection. So we will have these codes where the duration will be there, like the sample is being collected in the hours of 8 to 24 hours. Okay, so in between if you are getting 12 hours, then you should go and check those P series codes, okay, storage codes. So here plasma, like frozen plasma, so you can check the code descriptions here. P9058 is for red blood cells, P9059 is for fresh frozen plasma, 8 to 24 hours of collection, and you can also see here it is each unit. Okay, so how many units you will get, based on the unit you have to give the units. So now if you check here in the question, they have ordered or they have given 2 units. Okay, 2 units. So 2 units in the sense P9059 with units 2 you have to give. Okay, so this is the correct answer for this particular question, and which is also an exam question, and it is important. Almost 2 students got the same question, so you can go through this question, and also if anything similar to this concept, storage concept, you can go through that as well. So next, last question. So you can see here a skin substitute graft, specifically aloe skin, to cover 10 square centimeter area for second degree of burn in left thigh from an iron. Okay, so here second degree or third degree, I'm not sure, but when I'm checking the mock paper, I got this question, so I hope they are questioning on second degree only. Okay, so answer, you can just go and check the HCPCS code for aloe skin. Okay, aloe skin codes are based on the square centimeter. So if you check Q4115, aloe skin per square centimeter, okay, which is per square centimeter, that means 1 square centimeter, right? So here they have given 10 square centimeter area, then you should give units 10. Okay, so Q4115 with units 10, and you can also check the ICD for second degree code. Okay, so the correct answer is Q4115 with units 10 and T24212A. Okay, so make sure you are checking the complete question, and if they give third degree here or first degree, please select the ICD accordingly. Okay, so these are the 5 questions. I do have more questions, but as of now, these 5 questions are very important, and as 2-3 students gave the same question, I have kept all the questions here. So for more important things or for